In terms of first dose appointments, over the next 7 days, there are some 8,000 Pfizer appointments on the books now for Victorians who are still yet to book in to do so. There's some 5,800 AstraZeneca vaccine first doses available, and as a result of more Moderna and a highly effective mRNA vaccine being made available from the Commonwealth, we now have some 28,000 new Moderna vaccine slots available. And it's important to also remember that as a result of the changes from the Commonwealth in regards to allocations, Pfizer is now also available for over 60s at GPs and primary healthcare clinics. I'll get Jerome to speak more broadly about this shortly in terms of the details, but as I say, Moderna as a mRNA vaccine that has more recently come on to the nation's vaccine, the Commonwealth's vaccine rollout, has now been more widely made available in Victoria, not just in community pharmacies, but now being made available to the state-run clinics. And I would encourage anyone to get that safe vaccine and do their bit to make sure that they get Victoria through those 70 and 80% double dose vaccination gateways as soon as we possibly can. As you know, we've been progressively reviewing the border settings between Victoria and New South Wales as the relative risks change and as we move progressively towards the opening up of the Victorian community under the national plan. And I can advise that we will be further improving the situation and stepping down the arrangements on the border between Victoria and New South Wales in the following ways to make it easier for Victorians to return and residents to return, as well as through the processes I'm outlined, improve movements between the two states and the ACT. Firstly, from midnight tonight, the red zones in New South Wales and the ACT, which are those areas not in lockdown, largely in regional New South Wales, they will change to orange zones. What that means is that both Victorians and non-Victorian residents returning from those areas will need to have a test after arriving within 72 hours and wait for a negative result prior to moving about the community. And secondly, in regards to the extreme risk zones, which are the lockdown areas in the ACT and New South Wales, largely Sydney, but a few other regional locations determined by New South Wales Health, they will change from extreme risk zones to red zones, and that means Victorian residents can return through an online application. They will need to test and home quarantine for 14 days, and we will continue to monitor, and as we are confident the risks continue to be mitigated in New South Wales, we want to make sure that we continue to keep a close eye on that, and if there are further changes to be made in due course, we will of course let everybody know. Finally, I just wanted to acknowledge that we are making today some significant announcements on the rollout of rapid antigen testing. As you will recall, the Commonwealth's Therapeutic Goods Administration Agency has approved the use of rapid antigen testing on a much wider basis as of the 1st of November. We've had rapid antigen testing as part of our toolkit for testing and serial monitoring of COVID in a range of different settings, but we will now be ramping that up considerably. Victorian Government will purchase for our health settings some 2.2 million rapid antigen tests for those services as part of a broader range of changes we're bringing to testing measures and increasing capacity for testing as we get closer to those two goals of 70% and 80%.